Bill 124 is a 1% wage cap that was given to all public sector healthcare workers. It affects us when we're bargaining in our wage increases, our benefits, our shift premiums, so it really leaves us at a disadvantage when we are bargaining.
The cap, meaning that we can only get 1%, it just sends a message that, you know, we aren't the heroes, we aren't valued by the government for everything that we do. The extra stresses, the trauma, the things that you may see and deal with, I think that it really just sends the message that we're not as valued as they were making us out to be.
I think the issue is that RPN is a female-dominated profession, and legislation was passed under Bill 124 that restricted us to a 1% raise when male-dominated professions are getting 12 and 14%, and it's not fair, it's not equitable.
During this COVID time, we change over patients every 24 hours. They come into the hospital, they're tested to see if they're COVID positive or negative, and every 24 hours, if their negative test comes in, we move them to a different room. So my work has basically tripled during this pandemic time.
The perception that the general public has is not correct. Our raises have not been great for the last 10 years. Our wages have been really small. The cost of living keeps going up, and our wages have been at a very low rate. People are not staying in healthcare because our wages are not increasing. The workload is increasing, and our pay is not. And our pay does not reflect the workload that we're dealing with.
I feel like our value has been capped at 1% due to Doug Ford. You know, he's not down there at the bedside, seeing what we're doing, seeing our scope of practice, what we are dealing with, as well as what our colleagues are dealing with, and how vital of a part of a team we are. You know, they implemented that, you know, they're looking at the numbers, but they're not looking at the patients, the nurses, the whole healthcare team.
It's kind of like they take that word hero and ruin it by putting Bill 124 in place. They're restricting me to having a 1% raise when inflation is 4% this year. So they're saying that I can get by with 3% less. Heroes get rewarded, not punished.
The Premier needs to show us, you know, by not capping our wages, that we are a valued part of society. Like, without the hospital and the healthcare system, where would we be, like, after this pandemic, right? It was only because of the healthcare workers that came in every day, regardless of being scared and stressed and worrying whether you were going to have the appropriate PPE to wear today. I think they need to show us that with more than, you know, just words, that we are valued, and, you know, we shouldn't be capped at 1%. We should be given, you know, what we're worth, basically.
Respect us, protect us, and pay us resonates with us as healthcare workers very strongly. We feel that during COVID we were heroes, and now we're kind of pushed to a side and we're not really appreciated anymore. The general public realizes that, and even other healthcare workers realize that we are important, the work that we do is important, and it needs to be, the workers themselves need to be protected, and they need to be paid for that work that they're doing.